Hello, this is Dr. Ben, and today I got a question regarding infant colic. And infant colic is extremely common, so before I head out the door to the office, I wanted to make a quick video and explain infant colic quickly to you guys. So infant colic, the main reasons, either food intolerances or from what mom is eating. So mom, if you have any gas from eating garlic or broccoli or beans, or if you have dairy and it's bugging you, or wheat and it's bugging you, it's going through your milk and getting the baby. So whatever foods cause you gas, eliminate, and babies' infant colic will improve greatly. And if you want to improve your own gas, recommend drinking a tablespoon, or actually let's start with a teaspoon of apple cider vinegar with a squeeze of I don't know, a lemon slice, and squeeze the lemon juice in that. Fill it with water, purified filtered water, and sip that for, I don't know, until you feel a slight warming in your stomach. As soon as you feel a slight warming in your stomach, stop and then begin eating your meal. That will increase your stomach acid and stimulate your digestive enzymes, which reduces the gas and bloating that you get. So not only are you going to be preventing colic or significantly reducing colic in your infant, but you're going to be enjoying increased digestion and enhanced absorption of your nutrients as well for little to nothing in terms of expense. So apple cider vinegar, lemon juice, purified water, sip, slightly warm, and drink before meals, and do it before every big meal. Okay? If that still doesn't reduce your gas and bloating, then there's something else going on that is beyond the scope of this video. So back to the infant colic. So do that for yourself. For the baby, I recommend keeping the baby upright. Do not feed the baby on a flat plane or upside down, or give the baby a bottle in the crib. With, a lot of moms will put rice meal and what have you inside the crib to make the baby calm and get a little bit of extra dose. Don't do that. Feed the baby, get the head upright a little bit, and the colic will definitely be improved. And we also see a side benefit of reduced ear infections as well. Because the ear tube is on a horizontal plane in infants, but as we age, the canal is at an angle, so it's a lot harder for fluids in adults to get through the ear. But as a baby, if you lay him down, the milk and other foods will just go right in the ear, causing ear infections. So that's another reason for another cause for colic is laying down and feeding. So prop the head up. Second one, or the third one, would be lactase or lactose intolerance. A lot of babies, especially preterm babies or very young ones, their digestive systems are very young, and they're still under development. And as they're developing, they're not able to secrete enzymes as well, because they're not being produced. So if you're giving your breast milk or you're giving a formula and they're getting colic, I would try a lactase enzyme. I have a lactase drops, it's called. It's by Seeking Health. It's very pure. It's very safe for preterm infants on pediatrician recommended. As you'll see on the website, I think there's 15 testimonials, and they're all 5-star right now regarding the safety and the efficacy for infants and colic. So do that, and you can do, as the baby is breastfeeding, you can just take one drop, you can place it on your finger, or you can just drop 1 or 2 drops in the baby's mouth. It is a glass dropper, so keep it on the outside of the baby's mouth so you don't hurt them. Or you can just put a couple drops right on your areola and your nipple there, and the baby will get the lactase drops that way. That's probably the safest way. Another reason for colic is babies do not have beneficial bacteria in their stomach upon birth. Basically, the digestive system is a sterile environment at birth in babies. The bacteria that they get originally is coming from your vaginal canal. It sounds gross, but it's not. The vaginal canal has a lot of beneficial bacteria that come from our digestive systems. So if you had a C-section, the baby's digestive tract is definitely sterile. If you had a vaginal birth, there's some beneficial bacteria in there, or there's some yeast. So if you're noticing thrush in your baby, that's definitely going to be causing some bowel disturbances and colic. So with that said, I recommend a quarter teaspoon of Probiotic Infant. Place, some on your washed finger, drop it right on the baby's tongue, or take a small spoon, a baby spoon, and put it in the baby's mouth. The baby will just chomp on it, usually pretty ravenously, because the taste is quite good. I have to fight my youngest. He's 2, and he's all over it right now. He loves the taste. So quarter teaspoon of that. I would do it twice a day, and that will resolve a lot of colic issues. The side benefit of probiotic infant probiotic is also the fact that probiotics, the beneficial bacteria found in probiotic infant, also bind toxins from our environment, and they stimulate lactose digestion. They improve the immune system, and they also have shown to reduce allergies later in life in the kids, and skin issues later in the kids. So the benefit of probiotics is huge, and if there is one product that you're going to get to reduce colic in an infant, I would lean towards the Probiotic Infant over the lactase drops. But you may need both. So, okay, I think that pretty much covers the issues with colic. There's another trick you can do for colic is you can take a little bit of castor oil and rub it on the baby's tummy, and put a warm dry towel there as well. You can just stick a towel in the dryer and wrap baby around in that towel gently, just around the tummy, and put that above the castor oil, and that will help resolve the pain. You can also get the Highlands, I think they're called Colic Relief or Colic Tabs, and they're very beneficial at reducing colic. Okay, that's it. Until next time, talk to you then. Take care.